The most common question parents ask is, how do I prevent my child or my sibling from having a seizure? And that's a tough question to answer.
It is. I don't know if you can really prevent epilepsy. You can, if a person's been diagnosed, prevent seizures by doing, not always, but some of the time there are certain things that you can do, like making sure they get enough sleep, making sure that they don't miss any medication or they don't take the medications late, that they're not drinking alcohol or using any other illicit drugs that can lower the seizure threshold.
There are some medications that can trigger seizures, and I think it's important for you, if you're taking any other medications, to discuss that with your doctor. There are certain psychiatric medications that can trigger the epilepsy, and even some blood pressure medications. So I think it's important to have that conversation with your doctor if you're taking anything else that's not an anti-seizure medication with it.
Right, that as well as the question about timing of the medications, how often you give them, what happens, what you do. You should ask your doctor if you miss a dose, do you take it late, do you double up the next dose? Those are all important things to ask the doctor.
And stomach problems. So patients who are on antacids, on other GI medications, if patients have vomiting and diarrhea, that also can affect the levels.
Right, patients with colostomies can affect the levels. People with renal failure, kidney disease, that can also affect the levels of the medication.
And even alternative medications, there's some vitamins and herbs that have been known to interfere with the absorption of the medications.
And to lower the seizure threshold.
So basically, how you can prevent seizures is getting plenty of sleep, eating well, taking your medications on a regular time. If you're gonna sleep late, set your alarm to get up and just take the pills and go back to sleep. And really have a discussion with your doctor about what other medications you're on to make sure that there's no interactions. And this will really be the best way to prevent you from having seizures.